Good evening. Welcome to EMA Thursday Talking Points. Tim Richmond with the Wappo County Emergency Management. And this evening I have with me three other panelists. You know Linnell Deers from Wappo County Public Health. I'll also have Leslie Conning from John Deere Ottumwa Works and Zena Boyd from JBS Ottumwa. So thank you all for being here. And tonight we wanted to talk about our partnerships with our local business community, and especially two of our major employers here in Ottumwa. Several exciting things going on with those two partners, and I'll let them talk more in depth about the preparedness steps that they're taking. But I wanted to compliment both of them on some things we're working on together. Today, I had the privilege of delivering PPE supplies to a lot of the partners in our healthcare coalition locally. John Deere has utilized some of their workforce and their corporate structure to produce face shields for our healthcare providers. And this is a huge need for us as we strive to preserve PPE and extend the life of those masks as much as possible. And these face shields are going to help us do that. So thank you for that. And thank you to the UAW workers for assisting you in that mission. That's been huge. JBS has been working closely with the Wappo County Public Health Department this week and taking some steps to educate employees on what they can do to protect their workforce. We've heard a lot in the news about COVID getting into some meatpacking plants, and they're working very diligently to make sure that we can take what steps we can to prevent that happening in our community. So thank you for that collaborative effort, and we'll continue to support both of your workforces in that regard. So this just calls out the type of collaborative work that we've been doing with a lot of different partners in our community, especially vendors and industry that can step up and provide some options to us. The effects of this pandemic, as the World Health Organization officially declared on March 11th, is very unpredictable. We're learning every day as we go. But the impact on businesses, business organizations, their customers, their vendors in our communities has been quite considerable. And there's a natural tendency for panic to arise, and you've seen a lot of that chatter in the national media. To help turn panic into a productive response, businesses such as John Deere and JBS are taking proactive steps to prepare. Every industry will be impacted, and staff during this period may be unable to work due to sickness, either directly or indirectly. Even if employers are not, some will be affected by the need to care for their ill family members. They may also need flexible working hours due to school and daycare closings. It's important that businesses who are still operational carefully prepare mitigation strategies to protect the health and safety of their workers and integrity of their business operations during this pandemic. You know, mitigation is really the only tool we have right now to suppress the spread of COVID. It's the only tool in our toolbox until we really are able to learn more about this virus scientifically and develop any vaccines that might be available. And I'm pleased to have these two business leaders with us tonight to talk about what things are doing specifically in their respective organizations. So with that, Leslie, would you like to talk about what's going on at John Deere?
Absolutely. Thanks for the introduction, Tim. And it really is my pleasure to be here today. I think, you know, if there's anything that each of us have learned through this pandemic is that we're stronger together. We can learn from each other. We can make sure that the steps that we take keep each other safe and all of our businesses, employees, and communities. So with that, I've got a few things that I'd want to share, but maybe just to step back and just remind everybody from John Deere's perspective, you know, as designated by the President of the United States in the coronavirus guidance for America, John Deere is one of a part of the food supply industry, as well as several other pieces of critical infrastructure that have been designated as critical to maintaining the essential well-being of our communities and national resilience. So under that guidance, we continue to operate, and we do that because we're very committed to supporting our farmers and those involved in infrastructure and food production. But absolutely, first and foremost, you know, we do this to protect the health and safety of our employees. We're very committed to making sure that we're taking all of the appropriate steps that we can to ensure the safety of our employees and our community. So I want to take a couple of minutes and just share some of the items that John Deere has done. I'm going to start maybe at the big picture at our larger enterprise level. And one of the things that John Deere, like many industries, is very focused on planning for events. I don't know that we ever knew exactly what we were planning for, but we definitely start with our business continuation plans as a foundation for how we go about continuing operations in the face of any adversity. And in the face of the COVID-19 pandemic, we've certainly been able to start with a very strong foundation. And that foundation starts with coordination, communication, and collaboration. And that starts at our enterprise levels and then our daily teams, our factory level teams. And so we've got a daily factory level incident response team that meets every day, that includes cross-functional leaders from across our business and our UAW leadership, local leadership, to help us really collaborate and identify what are all of the things that we need to do, what are our top priorities, and how do we make sure we're working together. And our critical steps through there is making sure that we're developing our plans, identifying our small execution and action teams, and then maintaining communication with all of our employees. And so we take a daily time to communicate with all of our frontline supervisors, the actions coming out of that team, answer questions, because we know that if people understand what's going on, they understand why actions are being taken, they can be not only more bought in to implementing change, but they can also be part of the solutions. 10 people in a conference room aren't always going to have the right answer. We absolutely rely on the collaboration, innovation, and ideas coming up from all of our team members. So we think these communication forums are critical to the success of any business being able to navigate the challenges that you face through a pandemic with all of our employees. So to step back and think about what are all of the different ways that we can minimize the risk to the factory, there's been several actions taken. So certainly very early on, there were travel restrictions, both domestic and international, that allowed us to reduce the number of people traveling out and bringing anything back into our business. We also shut down all tours and visitors that were planned to come into the facility, again, to reduce that potential exposure. Within the facility, we closed a lot of our on-site services. We have an on-site fitness center. Again, that represents another high-touch opportunity for transmissions. We closed those types of facilities. And like many businesses, we made the tough decision operationally, but to make sure that those workers who could do their work remotely, who could effectively execute their tasks that weren't directly tied to the production operations, we asked them to go work from home or work from an offsite location. And that really gave us the opportunity to do a couple of things, to prioritize our cleaning and supplies and other services for those employees who did need to be there to continue to execute our critical tasks and operations, and also to just reduce the risk, right? The less people that you have coming in who potentially don't need to be there, then the less risk we bring into our business. So that remote work was another great opportunity to protect the team members that are on site and critical to continuing operations. It also allowed us to then take the workers on site and spread them out even further. We've got a pretty large campus. We've got 1.2 million square feet under roof for all of our employees. We've got the opportunity to spread a lot of people out, but there are some areas where people were working a little bit closer together, and having those workers off site allowed us to spread out the workers who were on site. One of the other things that we've done is really taken a critical look of all of the tasks that happen. We understand the importance of social distancing, maintaining at least 6 feet of space between employees, but we know there are some tasks where you just can't do that. And so it's been a very important part of our early response to take a critical evaluation. Can we change anything with those tasks to spread people out? And if we can't, evaluate what PPE options we might have for people. And so one of the innovations that came up through our business is what I've got here, which is a ball cap mounted face shield. So model for the group, but these ball cap mounted face shields are a great opportunity for employees to create that barrier between them and another person in the event they do have to get closer than the social distancing guidelines, and really for a lot of other applications to just create that additional barrier and that additional space. This was created using 3D printed clips, and we've got the information on how to download the design for those clips and make those on John Deere's public website. So if you're interested in learning more about that innovation, it's available through johndeere.com as a way to understand how to produce those. But we've also used plexiglass and other things where possible to create barriers between employees. The other thing that we've identified is that those high touch surfaces create opportunity for transmission. So wherever possible throughout our facilities, we've propped open doors. In weather like today where it's snowing outside, it might get a little bit cold and you'll wear a sweater. But it gives the opportunity to, again, just reduce those spots. We've also created one-touch solutions for some of those areas where employees do need to touch. So maybe whether that's gloves for using a microwave or a vending machine, or a printer, all of those other opportunities where somebody can take a one-use solution. Again, with a lot of food service not happening, there's supply of those that just regular food service type gloves that create a one-touch opportunity, and that's been a great solution for our employees to reduce those high-touch surfaces and reduce risk. Wherever possible, certainly one of those primary tools is social distancing. So all meetings have been moved to virtual with very, very, very few exceptions. And I'll tell you, before this, the phone didn't ring that much. It rings a lot more these days, right? Used to do more face-to-face or instant message, but it's been a good resurgence of a simple telephone call where somebody rings and just talks to their colleagues. So that's been fantastic. And then also the other piece with these protocols and changes to behavior is it takes constant reminders. So we've really been very focused and diligent in our communication strategies to make sure that we use all of the mechanisms we have available to communicate those reminders to all employees in high traffic areas, on our factory TV screens, those different opportunities to remind people about proper hygiene, good practices, and recommendations for social distancing. I would say we started with a great baseline for cleaning, but we've really enhanced our cleaning and sanitation throughout the facility. We've added staff and increased the amount of focus that has been made on those one-touch areas or those high-touch areas, as well as deep cleaning in different areas. We've made hand sanitizer available in a lot of different locations for employees to be able to access coming in and out of the facility, as well as scattered throughout in different locations in common areas and break spaces. Last off, I mentioned the innovations of things like the face shields, but innovation is one of John Deere's core values. And there's been a variety of different 3D printed or other solutions that have been brought up and shared from our employees and across our different units. But things like hands-free door openers, where you can use your arm instead of your hand to open a door, as well as different specifications for other kinds of different door openers or foot push. So a lot of really great solutions that have been a strong investment. So really to wrap up, I'll close with a couple of different comments. Certainly appreciate the collaboration that we've had with Tim and the emergency management services. We've been very proud, as been consistent with our history, to support the community through donations, and pleased to be able to work in strong collaboration with our local emergency management to do that. to do those donations. But overall, we're continuing to monitor the guidance from regulatory bodies and state and federal officials to make sure that we're making the best decisions for our company and for our employees. Our effort to keep our factories running is to ensure we keep our customers operational with parts, service, finance, and support, and the equipment they rely on. As spring comes, which it will, farmers are in the field and growing food for our nation and for the world. And it's an important part of what we do to make sure we continue to support them. But we do that in a way that keeps our employees safe. So pleased to have the opportunity to share some of the innovations and some of the activities that we're taking in the face of this pandemic to help our community, and hope that those ideas can help others as well.
Thank you, Leslie. We're always proud to have John Deere as a part of our community as well. And I'll tell everyone, it was, I think, just a short 2-week window. But when I received the first email from the corporate office, and then directly from your plant communications and the team I've been working with at your plant, to today when they're delivering products. So you were quick to step up and deliver, and appreciate that. We're proud of your John Deere team and both locals, 343, correct? And
We're helped in the production of the face shields,
Yep,
one of our other locals, and Local 74.
And Local 74 here in
Yep.
Ottumwa that was involved in that as well. So thank you to all those teams. Another great local partner, JBS, also heavily involved in our food production, making those tasty chops and all those other things. So tell us what's going on in your world.
Much like John Deere, we're essential infrastructure within the business of food and producing stuff for the country. So it's essential that we maintain openness. So the mask, I apologize, you can't hear me. We've implemented this 100% within our facilities starting this week, and we're also encouraging everybody to wear them outside. So not only is the precautions that we're taking within the facility important, we're telling people that we need to make sure we're protecting our essential employees outside as well, whether they go to the grocery store or any other time that they're outside of their home, having one-on-one meetings with our employees. So we have 2,300 employees that come through the facility every day, plus about 200 contractors. So we have a lot of people that are through that facility. Our facility is similar in size to John Deere. We're about 1 million square feet underneath the roof. So we have a lot of people that are coming through, and they do work in close proximity. So we've done a lot of things over the course. We started early. End of February is when we started making action plans and putting in place different things to make sure that we're protecting our employees. So starting from the very beginning, as soon as our employees come in, their temperatures are taken. We have an infrared scanner that detects all their temperatures. 100% of the people that come into the facilities. We stopped international travel and any kind of travel early on as well, not allowing any visitors. A questionnaire that every single person answers that comes into the facility, as well as we're continuing to hire. We need the extra people to make sure that we're keeping up with production. So we also have lines on the floors to maintain that 6 feet distance for everybody so that they understand. Sometimes people have a hard time judging what that social distance is, so we're helping them with that. Our cafeteria, obviously we have a lot of people that are going in to have their lunches and breaks, so we added additional space out with the tent outside. We also have a care center right at the beginning of the guard shack so that people, if they don't feel well, they go in there, they can get evaluated. We'll send them home for either 24 or 72 hours, depending on what their condition is, and ask them to seek medical help if they need to. We have a live health online app where our employees can they can live FaceTime with a actual healthcare provider, so they don't actually have to go to the doctor if they don't need to. We also allow them to, we have some high risk categories that we sat down and talked to and encourage them to maybe take time off while the emergency order is in place. People that are pregnant, being treated for cancer, over a certain age, dialysis, those type of things. And then they will get paid short-term disability and get benefits during that time because we know that they're at high risk. We encourage all of our team members to make sure they're evaluating themselves for any illnesses and staying home. So we encourage that while it's important for us to be maintaining business and running, it is important that they maintain their health as well. So it's very important to us. In our cafeterias, we put up shields and barriers so that we're maintaining social distance, and in places where we can't, we've marked off spots so that they don't sit next to each other. On the production floor, we put up barriers between areas where we can't maintain the 6 feet so that people that are working next to each other have that additional barrier for them. We continue to find new ways every day to help protect them. We've increased the amount of hand sanitizers. We also spray all of the floors and the sidewalks and the ground from the guard shack clear through the entire production floor. We have a full-time team that goes through and sanitizes any touch surface that employees might touch, whether it's the walls or the vending machines or doors. We've had most of our doors propped open in order to make sure that those continue additional sanitation. We also have a team that comes in on Sunday when we're not producing and does a very deep clean. We do some fogging and some spraying of high traffic areas as well for bleach solution in order to make sure we're sanitizing. As a food producer, we sanitize the production lines every single night as part of our regular cleaning routine, but we make sure that we're doing a deep cleaning on some common areas that employees go through on a regular basis. We have, like I said before, we're continuing to hire people, so we've changed the way that we do our orientations as well. So we bring in less people, break up the amount of people, doing several different sessions so that way we don't have as many people. Before we bring anybody in for interviews, we're making sure that we're checking their temperatures. We're making sure that we are screening them, asking them where they've been, who they've been in contact with as well. So we have a very great support system with JVS Global out of Greeley. They have helped us with a variety of different mask options that we have been bringing employees from the disposable masks to reusable masks to the baklavas that we brought in. We've got several different options for employees to have as well as shields. And we continue to support them in their decisions of what kind of face coverings they want to wear. We also make sure that we're supporting the community. So we have a great relationship with Wapello County Department of Public Health, and the mayor and everybody has been very supportive, keeping in constant contact with them. So we've donated to some local areas for food that they can't get out. So whether it's the school system to help with some of the school lunch programs that they're doing, or some of the nursing homes in the community, we're donating food to them. We're also helping our employees who, when this very first started, it was very difficult to get meat in the stores. So a lot of them were at work during the day, and by the time they got off, there wasn't anything available. So we've increased the amount of product that is available to our employees, so that way they don't have to worry about going out and going to the store and not being able to get what they need because they're at work trying to help the community. We're very fortunate that we have such a strong company that continues to support us and pushes us to make sure that we're doing everything we can possibly to protect our employees, answer their questions, keeping open lines of communication. We don't have as many meetings as we used to. Like you said, the phone does ring a lot more, and you realize how many meetings you really did have before that could be done in different ways. So we've been very innovative with that, teledoc or some different options. Did several virtual interviews today, which is a new thing for us as well. So we have 5 pork facilities. Atumwa is just one of them, and we've all share best practices on a regular basis on what everybody's doing and making sure that everybody is doing everything that we can to ensure the safety of our employees. So we're very lucky that we have that great support system and that our employees are very receptive, and we call them food heroes. So that's what we tell all of our employees. You guys are food heroes. You're helping to feed your families and your neighbors and the nation, and how important it is the work that we do, as well as making sure that they're protecting themselves on a regular basis. So those are the things that we're doing. And like I said, every day we find something new that we're doing. We have videos that we play in the cafeteria. We're following the CDC guidelines on everything that we can. And it'll show that the videos will tell them how to wear a mask, or recently we have found that there's particulates that can hang in the air for a certain amount of time. So that was the reason that we're encouraging the face masking, to make sure we're protecting ourselves as well as others. So.
Well, thank you for everything you're doing, and thank you for your leadership. And it is a challenge to keep up with all this as the learning evolves in the science, and the brain in my room, the Emergency Operations Center that keeps up with all that, is our Public Health Director, Lynell Deers. And I'll let her tell us what's going on behind the scenes with that.
Thank you, Tim. This is unprecedented times, and it is not easy. We want everyone to know that the actions they are taking, staying away from groups of people and keeping a 6-foot distance from other individuals, are important and make a difference. Social distancing helps stop the spread of COVID-19. Many questions have arisen as to what happens when a person tests positive for COVID-19. Testing and surveillance is a vital piece of local public health's efforts to beat COVID-19. While it is very important for community protective measures, it is also a very private and confidential. Local public health organizations cannot publicly release a person's name or address. They cannot comment on a person's medical condition or hospitalization. Information that can be released includes increases in positive cases, recoveries, and a person's age range. When people become sick, they are asked to notify their employer. Employers are encouraged to work with local health departments to be proactive in risk management. As part of the risk assessment and public health management of people with COVID-19, public health personnel will typically conduct phone interviews and assess the individuals for the symptoms of COVID-19. Local public health also identifies who the close contacts are and that would need to be quarantined for the 14 days. Local public health officials will also work with families to educate and help persons with COVID-19 protect themselves and their families. We also discuss what it is they need to do in their homes to keep everyone safe and also the communities from further spread of the illness. After the initial intake, Iowa Department of Public Health requires additional contact at 7 days and every 3 days thereafter until symptoms improve. But please note, these are just recommendations from Iowa Department of Public Health as a baseline. If we feel that individual needs to be contacted more frequently, the local public health will be contacting them. People with COVID-19 may stop the home isolation under the following conditions. Local public health staff inform the person when they are no longer under isolation. Local public health staff evaluate that COVID-19 individual for the following. You've had no fever for 72 hours. That is 3 full days of no fever without the use of any medication that reduces a fever. And their symptoms have improved. That means if they had extreme shortness of breath, they are able to breathe a lot better and they are feeling better. And lastly, at least 7 days have passed since the first day that the local public health called them to initiate the follow-up. In all cases, we follow the guidelines of your healthcare provider and the local health department. The decision to stop home isolation will be made by the local health department. As always, Wapello County Public Health continues to strongly urge Wapello County residents to stay home when possible and only go out for essential needs. When you go out, go by yourself. Please don't take your family or small children with you. Leave your other people at home, especially the elderly. If you are a person that is older, the grocery stores have initiated that time early in the morning for you, and I highly recommend that you take that opportunity to shop at the early hour that they have designated for those individuals. Wear a mask if you have one. When you're out, maintain a social distance of 6 feet or more from others at all times. Wash your hands frequently and cover your coughs and sneezes. Thank you very much. We want this community to continue to stay healthy and safe.
Thank you, Linnell. Just to wrap up this evening's session, I want to thank Zena and Leslie for being here, and thank you for your leadership in your respective organizations. And we appreciate you taking care of your employees, and we appreciate your employees always stepping up to take care of our community. I'll remind everyone that we work very hard in the Emergency Operations Center. It's a joint venture with my agency and public health to get the best information out to you that we can. And we use the emergency management webpage, wapelloready.org, to put the most current information out there. There's a ton of information out there from very great sources like the CDC and IDPH. We've tried to take all that massive information and digest it into something more user-friendly for our citizens. And I feel we've done a good job with that. There's great information on there for individuals and families and businesses, whether it's information about how to deal with the virus itself, or whether it's information about where to find assistance for your businesses, for small loans to keep businesses afloat that are experiencing hard times, or whether it's unemployment benefits or anything of that nature. So we encourage people to visit that website. Also on there is the information about the clinics. Our community strategy for dealing with this is to utilize our 10 different clinics countywide to handle your questions. We encourage you to call ahead, and they will be able to screen you over the phone and give you good medical advice and direct you whether you need to actually come in or go to the hospital. And that really protects our hospital to be open and have capacity to deal with our most critical patients. And here in the next week, we'll be partnering with all of our local grocery stores to put a flyer in your grocery sack with that information to contact all of our clinics. So with that, we'll close for this evening's talking points, and we'll be here again next Thursday. And thanks everyone for being here.
Thank you, Tim.
Thank you.